There comes a time in every proud ovary owner's life where they will have to deal with the widely dreaded and misunderstood means of sexual maturation, which of course entails the lovely bonus of the ability to grow a literal human being inside of the uterus as a result of the implantation of an embryo, or in other words, pregnancy. Of course, this so-called miracle of life is not always safe, financially realistic, or desired by certain individuals, which leads us into the theme of the hour, birth control. Well, more specifically, hormonal oral contraceptives. Hormonal oral contraceptives for females, more widely known as the pill, is available in multiple forms. The first being the combination pill, which contains synthetic estrogen and progestin, which is a form of progesterone. Another form being the mini pill, a progestin-only pill. This may be safer for individuals who are breastfeeding or who are more susceptible to blood clots and strokes. The most standard pack of pills contains 21 active hormone pills and 7 placebo pills to allow for the withdrawal bleeding of the thin endometrium to occur. When taken properly, the pill can be up to 99% effective. Proper use would mean a pill is taken at the exact same time every day. However, perfect use is uncommon, meaning realistically the pill is more so around 91% effective. Although this seems like a rather reliable method, which it is, it's always important to consider the side effects and risks. Most common symptoms include headaches, nausea, sore breasts, period changes, and spotting between periods. Risks in more severe cases while using the combination pill include heart attack, stroke, blood clots, and liver tumors. The female reproductive system consists of 2 separate yet closely related cycles, the ovarian cycle and the uterine cycle. Normally, these intertwined cycles allow for pregnancy to occur. Hormonal contraceptives, specifically the birth control pill, is a preventative measure taken to avoid pregnancy altogether. The pill works by using negative feedback to prevent ovulation and implantation of an embryo, similarly to how the female hormonal cycle halts during pregnancy, but we'll get to all those details later. The ovarian cycle occurs in, you guessed it, the ovaries. The ovaries contain follicles, and the follicles are composed of a primary oocyte, which is an immature ovum, as well as granulosa cells, which are follicle cells. During the follicular phase, approximately days 6 to 13 in the menstrual cycle, secretion of follicle-stimulating hormone, or FSH, occurs, which aids in the maturation of a follicle. This maturing follicle secretes estrogen to inhibit the release of FSH and triggers the release of luteinizing hormone, or LH, from the pituitary gland. The sudden release of LH causes ovulation, which occurs around day 14 of the menstrual cycle. This is the bursting of the mature follicle, releasing the ovum from the ovary, which is then guided to the fallopian tube by the fimbriae. Around days 15 through 28, the luteal phase occurs. During this phase, the ruptured follicle is transformed into the corpus luteum, which produces progesterone. Progesterone aids in the thickening and the retention of the endometrium layer, which is favorable for the implantation of an embryo. Progesterone also sends negative feedback to the hypothalamus and pituitary gland to suppress FSH and LH production to ensure no more follicles mature. If fertilization doesn't occur, the corpus luteum deteriorates, which halts the production of progesterone, allowing for the flow phase to start, or the shedding of the endometrium layer, which marks the beginning of the next cycle. Now, when using the pill, it prevents pregnancy in more ways than one. Firstly, it thickens the cervical mucus, lessening the chances of sperm to get by. The pill also alters the female hormonal cycle. The synthetic estrogen in the pill will travel to the hypothalamus and the pituitary gland through the bloodstream, negatively feeding back on the production of FSH to prevent follicles from maturing. Without a dominant follicle being presented, estrogen levels do not increase and the endometrium layer doesn't thicken. Constant high progesterone levels inhibits the surge of LH, which would otherwise cause ovulation, meaning no ovum is released to be fertilized. The continued dosage of estrogen and progestin maintains the suppression of LH and FSH. In short, the pill flattens the normally fluctuating hormones in the female hormone cycle, which will prevent ovulation and implantation. During the week of placebo pills, the thin uterine lining breaks down, which causes withdrawal bleeding. Now, you may or may not be thinking, why is it the uterus's owner's responsibility to mess around with their hormones to prevent fertilization, which in turn is a result of male gametes and not just their own? Well, I believe that society and misogyny has somewhat conditioned us to believe that it is the female's job, whereas it should really be an equal effort. Due to the general unwillingness of the male sex, male hormonal birth control has not been too widely researched. However, there are some other options such as vasectomies, which are reversible, barrier methods such as condoms, and the not-so-reliable withdrawal method. Even now, with the possibility of a male daily pill, only 30% of males were willing to try it, according to a 2020 survey conducted in England. Currently, there is a male hormonal oral contraceptive being researched called dimethandrolone undecanoate, or DMAU. This uses anabolic steroids to suppress FSH and LH production to simultaneously lower testosterone levels and stop spermatogenesis, all while trying to avoid the negative symptoms of lowered testosterone. By suppressing FSH, the seminiferous tubules will not produce sperm, and by inhibiting LH, testosterone made by the interstitial cells will be reduced. Long-term risks of DMAU are unknown. However, mild side effects such as acne, headaches, mild erectile dysfunction, reduced sex drive, fatigue, and slight weight gain have been reported. These symptoms, all while being similar to the symptoms that come along with the female hormonal birth control, have gotten in the way of bringing these pills to the market.